Hello everyone, my name is Nicole and I am a community representative here at Rancho Family. Today I'm with Rob McDaniel, who is going to share with us a little bit about what a physician assistant is and what they do in the clinic. But hi, thank you so much for being with us here today. Do you mind just sharing a little bit about yourself and how long you've been with Rancho Family?
Sure. My name's Rob McDaniel. I've been a physician assistant for 6 years. I was hired out of school to Rancho Family. I did several of my rotations, clinical rotations there. Worked with Dr. Combs, Dr. M, Dr. Madrid, and got offered a job out of school, and I've been there since September of 2015 now.
Great. So what would you say the role is for a physician assistant?
So my role has changed over the last 6 years. Initially, I was hired as family practice in the outpatient setting. I worked alongside Dr. Combs, so I helped coordinate care with his patients. I would see patients in the clinic. We would do minor procedures in the office like skin cancer excisions, different things like casting and sutures, laceration repairs, different things like that. And then initially that's what I started out doing, and then I moved into the urgent care for a little bit, and for the last 3 years I've pretty much exclusively been in the hospital seeing our patients.
So what would you say are kind of the similarities and the differences between a doctor and a PA?
I would say that about 85% of what we do overlaps. The PA profession was built and designed to complement the doctor. Essentially, the doctor can't be everywhere at once, and we provide that coverage. We aren't capable of practicing without the doctor, but we do have very, very similar roles in what we do in terms of we can order labs, we can interpret them, imaging, we provide care. We just work under the supervision of a doctor.
Got it. So can you give like referrals and those types of things to a patient as well?
So when a patient comes and sees us, essentially everything that they'll need, we can provide. Okay. It would just be if there's something above our level of care, then we would confer with the doctor, and they would either come in and help consult on the patient or offer their advice and expertise from there.
Okay, so you kind of touched on it, but what would you say are kind of like the importance or the benefits of a physician assistant in the office?
Yeah, exactly. So a PA really extends care for patients. So a lot of times there's long waits to see doctors. It's tough to get in. And if you have something that's not necessarily as urgent, or you have a PA that you've been established with and you have a good relationship with, they can handle almost all of your needs in the office. Most times patients come in and I introduce myself as a PA, and they still think I'm a doctor. Okay. So I will explain to them what I am, what my role is, and a lot of times patients can't really tell the difference. Okay. The longer they're with us, the more comfortable they get with us, and a lot of times patients don't even know the difference.
Got it. So there's a lot of things that you can do to take care of a patient, but if there's anything that's extensive or you need to talk with their doctor about it, that's something that you would be able to take care of as a PA.
Correct, yes.
Okay, got it. Well, thank you so much for sharing with us and just giving that information. That definitely helps clarify what a PA is and kind of your role. For anyone who has more questions or you want to learn more about Rancho Family, you can check us out at ranchofamilymed.com.